just thinking about like the pace of life we have between OR and meetings.
I know. It's crazy. I mean, you've done, I feel like you're like full throttle, full engaged in this year. I'm sure it's been crazy, but we do run at a pretty high pace and it's sort of go, go, go. I know every day that I have that's busy, you have another one with BOFNA the same way. So it's, you've been like pulling double duty. So I'm sure it's been crazy.
As busy as I think I am, I think you've got to be even busier. We just came from ACOS in Deer Valley, Utah. And then literally 48 hours later, we're doing like 50 plus cataracts. How many surgery days do you have lined up this week?
So today, this week I've got 2 cataract days. So I'll probably do 90 cataracts or more. And then however many LASIK we do Friday. And then I'll be off again to the shore Saturday, back again next week. We probably have 2 or 3 cataracts days next week. So it seems like right now we're on track to be doing every week 100 plus surgeries, like either cataract, LASIK, or both, or whatever it is.
Yeah, that's what I was referencing earlier. I keep thinking back to that week where you literally operated 5 days, every morning cataract surgery. And then I think we had 2 or 3 laser vision correction days that week as well. And we must have done 300 plus eyes.
Yeah, totally.
Between you, me, and Shamek. So it's just, but you think about like the impact that makes on people.
Yeah.
As surgeons, we're always trying to think, how can we, have better outcomes, do things more efficiently, help more people. But that's incredible.
Yeah. And we're always, and people say like, okay, well, when you're doing that kind of volume, I think you and I have discussed it. It seems to me, there's this correlation, inverse correlation of volume to complication rate. And more or less the only way to do that kind of volume, you have to eliminate virtually every complication. So if you can imagine, if you have a 10% complication rate, well, 300 cases in a month, okay, that means you have, let's say, 30 complicated cases spread over a month. But if you do 300 cases in a week and have a 10% complication rate, that's 30 complicated situations in that week that there's no way you can handle, or your staff can handle, or your referring doctors can handle. So more or less, the only way to continue higher volume is to more or less eliminate any potential complication. And so that sort of leads us to things like, say the drop regimen we have. Some people might say, okay, well, why are you doing intraocular antibiotics, intraocular steroids, plus postoperative, steroid, antibiotic, NSAID, and why are you doing both? Some people just do one or the other, and sort of more or less we've looked at like, okay, by adding the NSAID, we're going to reduce our CME rate by 2% to go from, let's say, 3% down to less than 1% or whatever it is. And if someone like, does it really matter? But at 300 cases in a week, that 2%, that's 6 cases of CME that you can eliminate by doing things like that. Yeah.